Welcome to Tea with the Experts and Dr. Leah Merle, your premier destination for mental health insights, empowerment, and inspiration. Led by the passionate therapist and counselor educator, Dr. Leah Merle, this interview-style podcast delves deep into diverse themes with top-notch experts in the field. Beginning with the What Is series, from anxiety, trauma to resilience and mindfulness. We sip our way through captivating conversations, psychological insights, shedding light on the complexities of mental wellness and what it means to be a human being. Each episode serves up a refreshing blend of knowledge, empathy, and empowerment, aiming to destigmatize mental health issues and raise awareness in an engaging and approaching manner. So grab your favorite cuppa and get ready to step yourself into transformative conversations that will leave you feeling uplifted and enlightened. Subscribe now and join the movement to break down barriers and foster a more compassionate world.
Welcome back to Tea with the Experts. I'm Dr. Leah Merle, and we're thrilled to have one of my favorite people in the whole wide world, Dr. Michael Drane, return to the podcast for a fascinating discussion. I am so excited to talk with this expert in this discussion today. So today's topic is sociopathy versus psychopathy. So we often hear these terms used interchangeably, especially in pop culture, social media. But actually, what do they mean? And what distinguishes a psychopath from a sociopath? So how do these differences play out in real life? So what do people see in the public? And so Dr. Drane is here to demystify these complex personality disorders, sharing insight from his work in counseling and psychology. So Dr. Mike Drane, welcome back, and thank you for joining me again on this exciting topic. How are you, friends?
Dr. Leah, it's such a pleasure. Hello. How are you?
I'm so good. Thank you for coming back on the podcast. I just wrote the phone.
Inviting me back onto the show. It's, last time we talked about imposter syndrome. We're going to talk about psychopaths, which seems like the natural next step, I guess, right?
It's the natural course of events, of course. I mean,
of course.
But I do have specific questions too, because this has always been a topic that I have come to you for consultation, because this is definitely an area that really is intimidating for me. And a lot of other people out in our field. It takes a lot to be a specific expert with this type of intense, I would say, diagnosis, right?
Yeah, I mean, the only reason I was not prepared by my education per se. You and I have a very similar, like, diplomas on our wall. You and I are, and so like they don't cover antisocial personality or psychopathy barely at all. But everything's a drinking from a fire hose in a master's program anyway. But no, there's a very niche field of counseling called forensic psychotherapy, forensic counseling. And that is how I got my start in the forensic hospital, interning there. So you and I used to train interns together. I was a scared intern, but instead we were staffing cases about mass shooters, cult leaders, serial killers, or lower level stuff, people that robbed convenience stores and things like that. So that's part of the problem with the diagnosis of antisocial, is it's way too broad, but we'll get into that, I'm sure.
Definitely. I think that the specifics and the semantics, I think, is really, really important, because it does get confusing even for clinicians. So why don't we start there, actually, Mike? Why don't you start by you kind of explaining a little bit about psychopathy and sociopathy? Like, how do professionals like us define these disorders, and what are the differences? I think starting there might be helpful.
Yeah, sure. Well, so the counselors have very abbreviated training when you first come out of grad school, and new counselors especially struggle just to get a grip on what the diagnostics that are in the DSM, because there's quite a few of them, as you know, let alone the ones that are not in. So, like you said, sociopath and psychopath are not. I cannot diagnose you as a psychopath. There's no way to do that. It's not an actual diagnostic term. The only thing, well, maybe not the only thing, but what they have in common, psychopath and sociopath, one thing they have in common is they're both kind of derivative of a personality disorder. So we'll start there at the high level. What is a personality disorder? It's when somebody has personality disorders are mental illness that has to do with my relationship to other people and people in the world and my role in society. So I have perceptions that are unhealthy or dangerous about how I understand myself and my environment. It has to do with how I express my emotions and how appropriate, socially appropriate the expression of those emotions are. It has to do with my interpersonal skills and relationships or the lack thereof. A big feature is impulse control. And, people with personality disorders have attitudes and behaviors that can be really rigid and inflexible, and they cause distress or impairment. So classic one, probably the most classic personality disorder somebody would recognize is a narcissistic personality. But there's actually at least 9 personality disorders that I can name off the top of my head. And part of the reason that psychopath and sociopath are so confusing is because, again, the only thing I could diagnose you with is something called antisocial personality disorder, which you would fold the concept of psychopath and sociopath, you would kind of fold it into this diagnosis, this very broad, in my opinion, way too broad category. Yeah. Because it covers everything from like somebody who like broke into a car or all the way to like a mass murderer serial killer. And other attempts that we can talk about have been made to make better scales than what the DSM-5 has. So yeah, go ahead. Sorry.
I was going to say it's everything in the kitchen sink. Like that's when I come to like a diagnosis as big as antisocial personality disorder, and we all know of people who potentially indicate that they have this type of symptomology out in the field, right? Out in politics or out just in general. But you could never diagnose antisocial personality disorder without a thorough assessment, right? And a significant amount of time of working with an individual. So I do think that it's important to state the differences between what these cluster of symptoms, let's say, can look like and misconceptions that people have. Because I think that's broad. People are always using the term narcissism, right? Oh, he's a narcissist. That person has narcissistic personality. And it's like, actually, maybe that individual has traits of narcissism. Maybe they lean towards narcissistic personality disorder, but it doesn't mean that they fit the criteria for a diagnosis, right?
Right. Or that it's necessarily a bad thing to be a narcissist per se. Like, the hot take here is that narcissism at a lower level is actually a healthy and necessary part of somebody's personality. I need to have some sort of self-esteem and not a grandiosity, but a sense of believing in myself. So you can take all mental illness exists on the spectrum, right? So you take these really extreme hardcore cases and and their symptoms are very extreme, like grandiosity and self-importance. Nobody wants that. But if you dial that down to something less severe, it becomes something like, I believe in myself. That's good, right? So a low healthy dose of narcissism is actually a necessary healthy part of a human makeup. So
yeah, I agree. And I love the way that you're talking about a spectrum approach.
Yep.
I do the same with clients, completely like trying to normalize one's experience, because I think that a spectrum approach can do that because everybody is different on a spectrum of symptomology. So like there's one side of it where you're super low on the narcissistic spectrum, where I always say to clients, like you're a jellyfish on the floor, like you're a people pleaser, people walk all over you, boundaries are really difficult.
Care too much about what people think of you, right?
Exactly, right? That's the lowest side of the narcissistic spectrum. Whereas the higher end is people who have that kind of solid structure of it's all about them, and they cannot possibly look at anybody else's needs or see anybody else's needs or have empathy. I think that's one of the other big characteristics, right? Is that lack of empathy for another person's experience.
Right. That would be something that a psychopath and a sociopath both have in common. It's hard to talk about those terms without getting too much in like diagnostic weeds that would confuse even like a therapist. But the way we categorize personality disorders now are a little strange. The easiest thing I could say about a psychopath versus a sociopath, and first of all, let's also say that not everybody even agrees on these terms. You can go Google right now, psychopath versus sociopath, and you will find all kinds of different interpretations of what it even means. So who knows? But the model that I have found useful, if I'm trying to extract some kernel of truth out of that, it would be that psychopaths are born, sociopaths are created. So sociopaths are a kind of trauma-based relational trauma, and in that way, they're very much like personality disorders. It's very rare to have a pure psychopathic, what I would call a psychopathic narcissist, meaning I'm simply born. There are no circumstances in my life. I'm just born with something in my brain does not feel or express empathy. I'm very impulsive. I might be angry. I might be, no interest in relationships. That's very rare. Most of the time, narcissism is a kind of trauma wound, just like all personality disorders.
That's a really great way to explain it. I hear that. I use that language myself versus, somebody who is born and somebody who is made based on trauma experiences. I think it's a really good way to explain the antisocial part of it, right? Because we could talk about complex post-traumatic stress disorder and complex trauma and attachment wounds and what that looks like all day. But I think sometimes it's not necessarily what people are interested in. This definitely seems to be something that pop culture, right, people are really interested in.
Yeah, society has a true crime fetish. I think everybody knows it. So, I've been my bread and butter on podcasting world for a long time. So there's no shortage of pop culture references and things like that. So because psychopath and sociopath, you can kind of like build the model from there. So if a psychopath is born, that means they already have innate qualities that lack empathy. There's nothing that really came to cause that. So that kind of thing's usually identified by adolescence. And what you would see is like somebody who is just, again, naturally, not because of anything that happened. It's not like your parents were bad to you or anything like that necessarily. Somebody's just you see in adolescence is kind of avoiding relationships or not really missing them, doesn't care that they're avoiding relationships, doesn't care that they don't have any friends at school. They prefer the solitary activities. Whereas a sociopath, the reason they've cut themselves off from society is because they have been rejected or abused in some way by society. So some part of their, I guess, humanity.
They've experienced, maybe, right?
Yeah. They had a human side, but it was damaged through trauma. And because it was damaged, at least there was something there, whereas like a pure psychopath, there's no point of empathy I can grab onto to help you build a moral compass because it's simply not in your brain to begin with.
Yeah, I absolutely agree with that. And, could you speak a little bit more about how those types of traits manifest in like real world settings and how maybe it affects like real world behavior and relationships? So at work, society, school, family, environments, that's kind of where we really start. People who come into therapy or counseling, that's where we start to see issues, right?
Right.
Environment.
One of the biggest differences between a born psychopath or created sociopath would be, again, a sociopath was perhaps had more human, traits, basically empathic and all that stuff, craves attention and craves relationships. That's what I mean by human. But it's been damaged, which means there's something there. So there's something there that might still be prone to feelings of rejection, for example. So that's when you would get like a stalker that might be a sociopath because they desperately are craving connection to the point where they will stalk a stranger or an ex-girlfriend or something. But they're engaging in all the behaviors that would be diagnostically antisocial personality. So they might lack the empathy because I don't care about your boundaries. I'm going to stand outside your window because I love you, that kind of stuff. But I might also break into your house and I might be arrested. And so the antisocial personality diagnosis is largely kind of behavioral. It's kind of explaining like you're breaking rules, you're breaking norms. Well, we all do that from time to time. Are we all antisocial? So it's a very, very broad category. But if I'm a sociopath, I might be committing those crimes and responding in an antisocial way. I might be doing it because I have a wound. I feel rejected. I feel abandoned. And maybe because of that, I feel angry and I'm going to lash out at somebody. Whereas a psychopath, they tend to be more reptilian, cold-blooded. They don't have necessarily that feeling of rejection because they never cared in the first place, right? So I'm not as likely to set off, like if you were in a relationship with a psychopath, let's say you married a psychopath, that whole relationship, they would simply be trying their best to fake the feelings that they should be feeling, faking the empathy and the connection. But if you guys broke up, they might not really care, right? Because it's fine. So there's no need for me to go stand outside your window or break into your house because I just don't give a shit about you, right? I don't care, right? Whereas the sociopath, but I might still, but I might have the thought, but you did have a really nice stereo in your house. I think I want that, right? So there's no regard for you. That's something I want, and I'm just meeting my needs, right? So I break into your house, but it's not about you. It's about the thing I thought you had or whatever. Whereas a sociopath might do it as a way to get back at you. It's more of an attachment wound, like a more of a borderline, turbulent relationship kind of quality. Is that making sense?
So it makes total sense.
Yeah.
It absolutely does. And the turbulent piece I think is apparent in both of those presentations, right? But then there's a clear genetic kind of component and then potentially an environmental component, right? And then a combination of both sometimes. So, so can you speak more about that? Like that, because we talk in the field about nature versus nurture, right? And I think that does come up in this conversation.
I mean, totally. The idea that is what you're taught in school, nature versus nurture. But the truth actually is, you are always a combination. We all are a combination of genetics and our environment. So you're not nature versus nurture. You're nature and nurture. You're the result of your nature plus your nurture. Because I can't escape either one of those conditions. You grew up in some kind of condition, and that had some kind of influence on you, regardless of your genetics. So your genetics might be your starting point, but how that was shaped is by our culture and our upbringing. So you're always nature and nurture, not nature versus nurture, right?
Both, right?
It's both and, right. I just want to say though, I forgot this piece and I wrote this down because this is really interesting. So back to the terminology real quick and I'll answer your question. So part of the reason that psychopath and sociopath don't make it into the diagnostic criteria is because they actually predate the diagnostic criteria altogether. The term psychopath was first used in 1885.
Not know that.
Yeah, far beyond. And like early Freudian psychology, they have these sort of what we would now see as archaic and misguided in some cases terms, where psychology in its infancy is trying to kind of name and categorize these things that they're seeing. And so they come up with psychopath as a kind of term for what we would now call antisocial or criminal behavior. But other terms come out of that, like hysteria, for example, is a classic one. So 1885, right? And then in 1940, what was it, 80 years later or whatever, the term sociopath comes out by Partridge, G.E. Partridge. He first records it in 1940, and he's doing it because he's trying to find an alternative to the word psychopath because he feels like it's too broad. So he tries to put in sociopath to kind of account for that, like, this person started off normal and they were damaged into being that born versus created bit.
Yeah.
And then, so psychopath in 1885, sociopath in 1940. And it's not until 1952 that we get the first DSM, Diagnostic Statistical Manual of Diagnostics. That's what we use to diagnose people. You know that. I'm saying that for your audience. But that doesn't come until 1952, right? So these are old terms that kind of had some use, to be honest. And I'd like to see them sort of incorporated back into things. But But yeah, so they're old terms that are somewhat outdated. So that's the bit of that that's really super interesting. Okay,
I have another question.
let's go.
I have one more question, and
Okay.
I'll forget it if I don't say it. So we were talking about like the differences in childhood. And so can you talk a little bit about when signs and symptoms of these two kind of clusters of symptomology start to manifest? Like, is it, I know adolescence is when we really start to see clearly, but like, are they often observable from childhood?
Yeah, they can be. And the reason you start to see it most prevalently in adolescence is because adolescence is when we start to make friends and integrate into society. And personality disorders are all about how we're interacting with other people and if we're within the norms of what's socially acceptable. So that really start to see it. Things that might have been there, but are really highlighted now that the kid is like in school, making friends or not, right? That's when you really start to see that stuff. Uh, Adolescence is kind of the big marker, but it can theoretically happen before that. Again, it's extremely rare, but if somebody's just a naturally born psychopath, which is a great name for a movie, actually, uh, you might see even a baby that is not super reactive, not making a lot of eye contact, not engaging, not crying for help, right? When they're crying in their crib or whatever, kind of all that like early attachment, disorganized attachment kind of symptomology that you would see.
Yeah.
It does. Again, I don't want people thinking like if their kid is not crying for them, it means their kid's a psychopath. There could be, first of all, it could be anything. There's all kinds of reasons it could be. But yeah, in the retrospect, you might look back at Ted Bundy and realize he wasn't super attached to his parents, as a baby, and then went on to kind of have weird relationships with his friends. And, you got like a Gary Ridgway that's like going around stabbing kids. And Ridgway's more of a sociopath because he definitely had some stuff happen in his childhood. But yeah, you would see like by adolescence, you'd see a adolescent that's avoiding close relationships and does not care that they don't have relationships. They don't feel lonely. They want to be alone, and they rarely date. They're not interested in the opposite sex or whatever. They're not going after any of that. They just don't care. There's no romance or sexual desire within them. Or if they do, it's in a very nefarious kind of power sort of way.
Yeah.
You have kids, and you do have children that wind up in sex offender hospitals or whatever because they sexually assaulted somebody. Even before adolescence, you can see that sometimes. Kids or adolescents, and this is true for adults, they're not really influenced by other people's opinions. They don't have a sense of morality. They don't take well to the concept of morality, of what's good, what's bad. They might appear detached. Even as a kid, they might have a kind of flat affect or little expression. Again, that could be all kinds of things. That could be autism. That could be all kinds of things. But it also could be this.
Yeah. Yeah. And there's definitely in pop culture this big kind of push towards like, oh my gosh, this individual was cruel to animals, so that's definitely, he's a psychopath, which what you're talking about is, yeah, that could be cruelty towards animals and a lack of empathy towards other individuals within relationship that could lead towards an antisocial diagnosis, but it's a cluster of symptoms. It's not just one thing. Yes.
You asked about the genetics versus the environment, right? So let me give you one study by Ferguson in 2010. He finds that as much as 50% of people with antisocial personality, they attribute it to genetics. So in other words, if you have antisocial personality, this study, which was a meta-analysis of a bunch of studies, finds that if you have antisocial personality, there's 50% chance that you genetically inherited that. And that one of your primary relatives, meaning your parents or your siblings, have it too. And that would be another indicator, a big indicator. Of course, if you're a sociopath, right, it's because you were traumatized by some abusive parent who clearly has their own stuff going on, right? So it's really hard to tease these things apart. And 50% genetic, that sounds like a lot. But then when you break it into, sociopath, psychopath, born, created, 50%, right? To at least two categories. And if it is genetic, So naturally born psychopaths, what they found is that the brain's paralimbic system, which plays a role in the development of antisocial personality, it's a group of brain structures that integrate internal, external stimuli. It helps us regulate our emotions, our motivation, our behaviors, and how we respond to stress. And that is damaged, just naturally damaged. And it also has to do with an underdeveloped orbital cortex, the part that controls impulse control, social and emotional decision making. And as a result, kids tend to not recognize social cues or the emotions underlining, so your parents trying to discipline you and you can't read their emotions, kind of in that way, similar to autism, because I'm having trouble reading the emotions by some mechanism of my brain. I just can't pick it up from you. So imagine the opportunity for learning that's missed for somebody with that condition.
Mm-hmm. That's really helpful to kind of break it down in that way and talk about the structure of how the brain is built and how that manifests. I think that's helpful. What about, obviously you've had a really, significant experience with this population, but from your experience, how do you think that these two kind of clusters that we're talking about impact society at large? So, in terms of crime, in terms of like in corporate settings, interpersonal relationships, we've talked about that already, but, in the workforce.
Well, that's an interesting question because, again, there is a level of antisocial personality that if it's not healthy, it's at least functional in the world. Imagine the advantage of somebody who's comfortable breaking the rules or bending the rules a little bit, little white lies or whatever. Imagine how somebody like that would get ahead in a career path versus somebody that wouldn't, right? So there is an amount that, while socially not acceptable, would be advantageous. And that's why, some experts will talk about like narcissists wind up being CEOs and positions of power, lawyers, doctors, politicians, that kind of thing. So that's one way. Personality disorders, including antisocial, which would include sociopath and psychopath, is more than any other personality disorder is linked to substance use more than any others. So that, right, all the impact of substance use. So, all kinds of micro and macro ways that would impact society. Somebody who's substance abuse and does not care about the rules is more likely to get drunk and get in a car and start driving through traffic, right? So you kill somebody doing that, perhaps. So that's a small example, but there's obviously bigger ways and systematic ways that could show up too. So it has all kinds of impacts. And then you can kind of reverse engineer the diagnosis for antisocial personality. Kind of means that most people who committed a crime, if it was not a self-defense or I was psychotic or out of my head or something, well, then I'm antisocial, right? I did something antisocial anyway. And if I wind up in a forensic hospital, I'd probably have that diagnosis. So technically, most people who commit crimes would qualify for antisocial personality. I don't think that's a good thing. I think that's, again, a symptom of the diagnosis being far too broad and part of the problem with it.
Yeah, that's absolutely wonderfully said. What about these folks being more inherently dangerous than the average person? Are there misunderstandings out there around their risk to others? What do you think about that?
I think the biggest misunderstanding, again, like culture has a serial killer fetish and a true crime fetish. Look how many true crime podcasts, myself included, that are out there. So everybody knows that. What people don't realize is, right, because mental illness exists on a spectrum, society is only paying attention to this extreme end of the pool, which is interesting and fascinating. But the thing they need to realize is like, there's people lower on the spectrum all around us to some degree. And you may not ever even know it. They might just be functional enough that they're actually quite successful in the world, again, because breaking rules and not caring about other people and stepping on people to get ahead in life. And that, all that would be really advantageous. So those people wind up being really successful sometimes, unless their mental illness is so bad. I mean, you have people that just can't help but, the urge to murder or the urge to hurt people is kind of similar to a sort of lust. Like most of us can understand sexual lust or sexual desire, something, an urge that kind of overcomes us and we become fixated and we're almost hungry for it, right? That's kind of like the lust, what I would describe as a kind of lust for power people. And part of that is the neurology behind it. So whether you're a psychopath or a sociopath, you probably have a diminished, well, especially the psychopath is going to have a lower threshold, a higher tolerance for stress, right? So their brain does not respond to stress. So they don't receive like the consequences of their actions. They're not scared to get in trouble at school or at work because their brain is not firing the danger light as it should. And so you wind up with people that are, kind of doing that all throughout in the world. And they feel very bored because then nothing stresses them out. Nothing stimulates them. And so they have to chase greater and greater stimulus, kind of like a drug. I have to get more and more of it to fill this kind of debilitated stimulus response. So whereas some people might get excited by riding a roller coaster or playing a video game or going out on a first date or whatever, that's too boring for an antisocial personality. A psychopath, it'd just be too naturally boring for them. And so they need to do something else. I can't just date you. I have to have control over you. I have to overpower you. I have to kill you. Or whatever that is, torture, all kinds of things. The sociopath, I might go on that date with you, and part of me is wanting that genuine connection because there's a little bit of humanity, but it's been damaged. So you see something like more like a borderline. I'm sensitive to rejection, and anything you say, I'm going to kind of make it turbulent, or I might test the boundaries of the relationship. Very much like a cluster B kind of personality disorder. But maybe you say something, right, that makes me feel rejected, like a borderline. Even if you didn't mean to, I just took it that way. And so now I'm going to hurt you, but I'm going to do it from this sense of like, you hurt me and I'm going to hurt you back. Or I want a connection to you, but just dating you is not enough. So I need to do more to you. I need to hurt you. I need to kill you. I need to torture you. I need to do other things to feel connected to you. I need to stalk you, right? Other things, but it's coming from this little kernel of humanity where I'm trying to get connection just in this really screwed up way.
Wow. So thought-provoking and so well explained.
It's just the coffee. I'm just drinking a lot. I'm very caffeinated. That's all it is.
Well, good, because this is an evening conversation. So, get that coffee. Without a doubt. I'm wondering about treatment, and I'm thinking in your experience and based on the research that you've done, like, do you think that it is actually possible to rehabilitate? So is it possible to treat psychopathology and the flip side of that? So really antisocial personality disorder is what we're talking about. But can we treat it effectively? And if so, what is the best approach, would you say?
Mm-hmm. Yeah, it's a great question. The broad answer is that we can treat it depending on how severe it is. Just like most mental illness, there's a spectrum of severity that goes beyond our reach. That is very similar with antisocial personality. I've interviewed people who I don't care that I murdered my mom. I don't care. You can't make me, and all the therapy in the world is not going to get me to care about that or see or generate a sense of remorse. So in those really extreme cases, I can't tap into your empathy. So I used to struggle a lot with this as an intern in the forensic hospital. Is like, I can't tap into your sense of empathy because you don't have it. So how do I rehabilitate you into any kind of level of functioning at all? In some measure. Well, I can't, right? So I need to at least regulate you so you don't hurt other people. So if I can't make you care about hurting other people, the one thing a psychopath usually cares about is themselves, right? They still have some sort of self-preservation mechanism. So what's done is you wind up going into a very Socratic method where I'm not trying to get you to care about the consequences of your actions, but I am trying to get you to realize there are consequences to your actions. So I'm asking you questions about, well, if you kill somebody, how's that going to impact you, right? I'm not going to make it about other people. You don't care, but surely you don't want to go to jail, right? So what are the consequences of these behaviors, right? And I make it very self-serving, right? It's all about how it's going to benefit or not benefit them. And that's really the only area to work on the severe end. And even then, sometimes they don't care. Think of like a mass shooter. Yeah, I'm going to kill these people and I'm going to kill myself. I don't care, right? I don't care. I don't even have the self-preservation bit. But then, other more on the sociopathic side, there's a lot more to work with. Because again, there's that kernel of humanity that's still there, but it might be damaged. And that is more about similar to like dialectic behavioral therapy or borderline personality. I'm teaching you emotional regulation, and I might be teaching you empathy because there's something in you that I can do that with. I can sort of take that muscle that might be weak or damaged, and I can help you strengthen it again, right? One of my favorite ones is a meditation, a compassion meditation, where you close your eyes and you might focus on your breath and kind of get into a meditative state. And then you think about somebody that you really deeply love. And a lot of sociopaths are married and have kids and care about people, believe it or not. Because again, it's a spectrum of severity. So some people, yeah, I genuinely care about people. So I have you focus on that person. And then I have you do what's called a metta meditation, where I am having you send feelings of gratitude. You're saying things like, may you be happy, may you be at peace. You're imagining that person and, having everything they ever wanted. And then you're paying attention to the feelings of goodwill that come up when I'm, if I was meditating about my good friend, Leah Merle, I might be thinking like, oh, Leah having all her dreams come true. That would make me so happy, right? And then practicing the muscle of feeling happy, knowing you're happy. And then paying attention to that to build awareness of it strengthens the empathy muscle. But now let's go to the harder level. It's easy to talk about somebody I care about, right? Dr. Leah, it's easy to imagine her, having everything she wants. What about a stranger? Somebody I feel neutral towards. Well, that would be the next level, right? Somebody like you or me could probably get there. We could think about a total stranger and we could cultivate compassion. But a sociopath might struggle with that. Psychopath probably couldn't get there at all. And then the even harder level would be having compassion for an enemy, somebody who's really hurt you or wronged you in some way. And then in that way, you build out, as in rings, starting with, and then for a psychopath, to answer your question, I can't get them to care about the stranger. They're going to want to kill their enemy, right? I can't even get them to care about their friends or even their spouse, but I can go to the nucleus and get them to care about themselves.
Yes. So it's that self-preservation piece, and it's the integral part of the human element that you're kind of tackling. And I mean, I think about the society that we're living in right now, right? In the United States of America, westernized society, we have just had a huge fake election. And it doesn't matter what side, I mean, it's a two-party system. I don't care what anybody says, but, finding compassion, which is what you're talking about, for other people that maybe don't agree with you or, don't agree with you, let's say, or on the other side. That's actually really difficult right now in this type of a climate. So what I'm kind of looking at is it doesn't mean because you don't have compassion for another person that they are falling towards that spectrum of sociopathy. But it's kind of a separate kind of entity, right?
Well, and we all have this function. Like, I care more about my friend than I do about the person that cut me off in traffic that I don't know, right? You have empathy. Empathy only has a certain reach. And the more I know you, the more empathy I have for you. The farther out I get from knowing you, you become just a statistic in my head, right? So you don't have to be psycho to understand how this works. We all kind of have that in a way.
Yeah, no, it's true. And I think that that's where the connection in relationship, right, and the trust that you build within relationship with another human being comes in, right? That kind of solidifies that. So, but also I wanted to kind of switch gears a little bit and talk about, kind of go back to treatment, right? For you treating in the forensic hospital, what kind of ethical considerations do NHPs, mental health professionals face, like yourself, like others that you were working alongside. What do you face when working with individuals diagnosed with antisocial personality?
Yeah, one of the biggest issues, ethical issues, is has to do with like Tarasov rules. So Tarasov is a girl that was killed by her boyfriend, I believe, actually up in Washington State. But I might have some of the details wrong here. But the boyfriend had tipped off the therapist that I was going to do it, and the therapist did not report it properly. Called the therapist, to his credit, or her credit, actually called the police and let the police know, but did not contact Tarasov herself. And because of that, the therapist lost their license, and now we have what's called Tarasov rule, which is basically the duty to warn others. And the writing, especially in Washington State, is really wonky. It says something about a therapist has special powers and therefore should know, when they're going to intend to kill somebody. Of course, there's no way to know that. We're not psychics, and it's way too incumbent on the therapist to somehow know what their client's going to do, which is not always predictable. So, yeah, so a big part of working with antisocial is you might have a client that's going to hurt you or somebody else, and then you were in one hell of a pickle ethically about your duty to warn. That's probably like the scariest. The Tarasov stuff is probably like, would you agree? Like one of the scariest ethical things that could happen, to a client or to a therapist. So there's that. There's also the transference and projection that comes. I've sat across from patients that have told horrible stories about hurting kids and all kinds of stuff. And yet my job is to hold space for this person and help them find a better way. So you have therapists have enough transference issues. Transference, by the way, is just the way that, not for you, but for your listeners, it's just the feelings that might come up in me that are triggered by the client I'm working with. And the client has it too. They are triggered by me based on whatever experiences. Maybe they have a bad experience with a male or something, or maybe I look like their brother, or who knows. And similarly, they would do the same for me. Our experiences that the client and therapist bring into the session is shaped by, whatever we've been through in our lives. And then the interaction between those therapists and the client, greatly determines the transference. And sometimes you've got clients that trigger the crap out of you, right? This. And sometimes, and in both ways, right? Sometimes you have clients that's like, man, I just love this person. I would totally be friends with them. I adore them. They're great, right? So it goes the other way too, where you feel transference in warm feelings towards the client. So yeah, I tell a story about a client in the forensic hospital who had just stabbed his mom. He was in the hospital, and his mom came to see him every week. He had no family except for her. She was the one person that came to see him. He finally got out after some 20 years or something, and within a week, he had stabbed her to death. So he comes back into the hospital, right? And now he's in for life because now it's a second offense, which is good. He probably needs to be, in my opinion. And I was sitting across from this guy, and he's crying, he's bawling, the most convincing cry you've ever seen, Leah. And he's telling me this story about my mom, and she used to come see me, and I just don't know why I would do something like that. And I'll describe it for people on audio. He's crying with his head in his hands, and he's just sobbing so hard. And I'm like looking at him, and I'm naive. I have all that. I'm like, oh my God, it's okay, man. It's all right, blah, blah. And then I noticed that he is peeking at me through his fingers to see my reaction, and that he is actually playing me to manipulate me because he knows that my evaluation is going to go to the judge and determine what happens to him next. And that's when it really hit me. They have the power to the really good ones can manipulate you, and there's really no way. I don't care how good you are. I've been fooled many times. People can be fooled. And so that's part of the transference as far as the ethics is like, how do I hold compassion for this person that in another context, I would stay 1,000 miles away from. And then there's one more that I can think of, which is like kind of similar to a defense lawyer. I was watching this, for Halloween, I was watching The Exorcism of Emily Rose. I don't know if you've ever seen that movie, but Laura Linney plays this defense lawyer who has a guilty conscience because she was representing a murderer. She helped get him off for murder, and then he went out and did it again. She's torn up about this, right? So therapists are in a similar position in that I might be helping to rehabilitate somebody only for them to go out and kill somebody else. And how do I live with that? So there's the guilt of that too. So there's actually it's a very heavy thing to work with for sure.
It sure is. And it takes a lot of experience. It takes a lot, right, to be able to hold space in these types of environments. And then you were talking about that example of the mother. And I wonder, that's a question that I want to ask directly, is how do families or loved ones of individuals, with these clusters of symptomology typically cope? And then what advice do you have for them, right? Because they have the connection and the relationship and the trust with these folks. It's not a mental health professional working with the individual. So what else is there?
I mean, it's really hard. And again, it depends on the level of severity at the lower ends, but even like societally functional narcissists are still bad to be in a relationship with. Like I was recently asked by somebody, how do you co-parent with a narcissist? My ex is a narcissist. What am I supposed to do? And my answer is like, well, you can't, right? You can't, because all the work is on them, and it's notoriously hard to treat, because if I think there's nothing wrong with me, why would I need a therapist to fix me? So, I don't have a good answer here, unfortunately. Basically, all you can do with people like that is set boundaries and protect yourself. And that's really hard if it's your partner or your dad or your sister or whatever, So that nice firm boundaries. And, but I'm also thinking of like, Ted Bundy's parents, who were interviewed several times after, Jeffrey Dahmer's too. Those are two examples of what I would call psychopaths that were born and had there's no known really like significant trauma. Some people have argued with me on that, but I don't see any. They'd probably score like a low on the ACEs, for example, the trauma assessment. And, they're interviewing these parents who are like Midwestern, salt of the earth religious folk who are like, I don't even know what to say. He was such a good kid. I had no idea, and they're crushed because now not only did their kid like kill a bunch of people, but they're the center of a sort of cultural phenomenon. And how many documentaries are on Netflix right now about Ted Bundy or Jeffrey Dahmer? I've personally been on a documentary about both of those people. So it's, there's a kind of fetish about it. Society both hates criminals, but is also attracted to them in this for sort of guilty pleasure kind of way.
Yeah. It's a push-pull, right? With society and pop culture, this kind of back and forward. You don't want to look at it, but you can't turn away. So it's definitely an intoxicating topic to kind of think about. What about fostering understanding? Like, do you think people can foster more understanding and more awareness of these two clusters without sensationalizing and stigmatizing by following these documentaries and by watching and researching and understanding more? I mean, what are your thoughts there regarding more understanding and awareness regarding the roots of this spectrum diagnosis?
I mean, I don't know. I have on one hand, society doesn't need any help raising awareness around, again, we have a true crime fetish in society. We don't need any help raising awareness around these issues. And I don't know that we can get us away from the fascination of it either.
Yeah.
And to some degree, we are normalized, like crime will always exist, throughout time, throughout culture. Crime is a derivative of society itself. I don't know that we get away from that. And so in some ways, we're normalized to the experience of criminal behavior. Also consider that, we all have, again, like we've all broken a rule here and there. We've all told a lie or lacked empathy. So on some level, we have to kind of look at ourselves, and on some level, it's just a function of humanity. So I don't know that it can be improved or helped. And any kind of psychoeducation that I might offer the public is pushed through this pipeline of a fetish for the thing, right? They're interested, they're fascinated to learn about it, right? It's not that they're going to, I don't know, necessarily go out and like advocate for awareness raising based on that, although maybe they will. And even if they did, what do we have them watch for?
Right.
I guess the biggest thing I could say is like some people very rarely are simply born this way, but the vast majority are created through trauma, right? So Early intervention is really important. Healthy families and healthy development is really important. And this is a consequence of what happens when we don't have it. And so, and just be careful. Again, I feel like I'm hopelessly outgunned here, but I would say do your homework and do your research, which I don't have a lot of faith in people's ability to do that. People sort of don't know what they're doing. They think they're doing research, but they're just on Facebook, right? So, or they're just watching a Netflix documentary. But there's a lot of misconceptions out there. So I guess tether yourself to actual professionals who know what they're doing. The vast majority of true crime podcasts, for example, is just some person in their garage that likes serial killers. They don't actually have any real clinical knowledge or actual experience other than what they are interested in. So I think that's something that gives, and I'm not the only one, but actual professionals out there who are really giving the clinical knowledge. But even then, I've got more expertise in this field than most therapists, and even for me, there's a lot of unknowns. So.
Yeah, and thank you for saying that, because it is so complicated. And really, this topic that we're talking about, it is a hugely popular subject, like you talked about, in movies, books, television, documentaries, Netflix, and
every story needs a villain.
Yeah.
Right? There is no conflict without antisocial personality, because that's just everybody being good. So what's the part of that?
Well, exactly. It's kind of like that human element. But I think of one of my most favorite shows that I've watched is the series of Dexter, right? So, I mean, really, if you've watched the series of Dexter, that is a depiction of a sociopath, right?
Yeah.
And if he was treated, he would be treated with Antisocial Personality Disorder, and he's had extremely traumatic experiences that he's lived through. He's obviously a villain, but it's, people have different perspectives. But so you've got somebody like Dexter, right? And then I think of Sons of Anarchy and the gangster culture and how they're depicted, and they're killing everybody all the time.
Every one of the Men of Mayhem and Sons of Anarchy could be diagnosed with antisocial personality. And that's the problem with the diagnosis. It's far too broad, and it would capture far too many of us to actually be of any use. But you're right. And Dexter, I watched Dexter just like everybody else did. 10 years ago, back in the heyday. So it's been a while. I saw the new one. It wasn't great, but you guys can tell me what you think.
It wasn't as good, but it was Dex. So for me, I don't watch it anyway.
Right. So, but that actually, so it's interesting to talk about the depictions of antisocial personality in pop culture and how that's evolved. Can we talk about that? Is that okay?
Yes, please. Let's talk about it.
Okay. This is all the candy that everybody wants to hear. So in the early days, psychopaths, sociopaths, whatever, first of all, there's no distinction in the early days. You have just villains, right? Reality is more black and white, good versus evil. So you have these really one-dimensional characters in the early depictions of it. So you have Leatherface from Texas Chainsaw Massacre. That dude has no backstory, not that I know of. He's just running around crazy person with a chainsaw. Or even something like the 90s, you got Buffalo Bill, Silence of the Lambs.
Silence of the Lambs. Oh my gosh, that's a big one.
Yeah, sure. Or Hannibal Lecter himself, right? So that's another. Later on, Hannibal gets a backstory, but originally, no backstory. He's just a psycho. Right? He just wants to kill people. They don't explain why. There's no origins. There's no was he born or was he created? Or Batman's the Joker, right? The Joker from Batman is another example of a very one-dimensional psychopath. And later on, you see attempts to kind of give a backstory. Why is this person the way they are? But nobody was really asking those questions in the early portrayals. So they were really exaggerated and characterized as sort of unpredictable and sadistic and sexually depraved and bizarre. And nobody knows why. And, they're the bad guy. That's it. That's all you need. Then later on, you start to, and I think Dexter was, in my opinion, sort of an interesting show, because you catch the transition of that in Dexter in the early seasons. So this would have been 2009 or something when this first started. I don't honestly remember. At least. Right? So you see he's just sort of more of a bloodthirsty killer. And then later on in the seasons, they start to give him a reason, a backstory. His Born in Blood, right? He watched his mom get murdered, or I can't quite remember. But he was covered in blood as a child, and they kind of pointed to this one traumatic event that sort of created it in the real world. If that is true, if that were a real case, I would tend to classify him more as a psychopath, Dexter, because although that's extremely traumatic, I don't think it's as likely that you were made a sociopath from this one event. If you assume, because Dexter's then adopted by a stable family who was very loving and stuff at a pretty early age. So I think if that was a more realistic depiction, Dexter would have recovered. He certainly would have been traumatized and needed help for that, but he had more good experiences than bad. And so it's not likely that that one thing created it. Sociopaths are created from repeated trauma, as are personality disorders, right? How, to put it another way, like how many borderline personality disorders come out of one event that happened in their childhood, right? It's not likely. And then later on, you get more realistic depictions where they have a more nuanced portrayal. And ever since, I think, Breaking Bad in 2008 starts this, where the story starts to follow the villain and sympathize with the villain. And so you get these, Dexter's another one. So you have these more nuanced portrayals showing psychopaths as seemingly normal with a kind of dark undercurrent to their personality. So you have like did you ever see You on Netflix, Joe Goldberg, the stalker show?
I didn't watch that one, but I know which one you mean. Yeah.
I mean, he's the narrator. It follows him around the whole time. And you almost don't know, just hearing him talk and his normal thoughts. And he just seems like a normal guy. And then like, wait, you're doing what now? And all of a sudden he's stalking this lady, and you can kind of see how he got there in his head. And because you're following his mental process, the audience is more like ready to accept that he's stalking this girl outside her window, right? Just like you're ready to accept that Walter White becomes a meth dealer because of what got him there, right? These more nuanced depictions. Annie Wilkes in Misery. If you ever saw Stephen King's Misery.
Oh, she's so, Kathy Bates is so I mean, I love her as an actress. So that is an amazing movie.
Yeah, there's these. So I'm kind of on, in my brain, I'm kind of on to these more interesting gray areas about media portrayals that question the ethics of antisocial personality. So like, you might know the show Walking Dead, The Walking Dead. It's a zombie show, right? Well, everybody in that show is killing everybody for survival. Is that still antisocial personality? If the behaviors are adaptive, if they're socially acceptable,
Right. If it's survival.
Survival, right? Is it still antisocial? Or when is antisocial personality justified? So, Dr. Michael Stone has made an attempt. He's a forensics guy. He passed away recently, and he developed what he calls the gradations of evil scale. And it's all the different reasons from 1 to 22, a scale that measures all the different reasons a person might kill somebody. And in that, you can see how psychopathic, sociopathic, antisocial they are. So level 1 would be a self-defense murder. You and I would be capable of that. We were just defending we had to kill you. You were trying to kill us, right? It's self-defense. Otherwise, I never would have done something like that. If it's only because my life was at stake. That's level 1. But then you crank it all the way up to level 23, and it's Richard Ramirez, right? I'm torturing somebody and sexually assaulting them, and I'm enjoying every minute of it. I'm not killing you because I'm defending myself. This is all me. I'm predatory. So there's all these reasons and why somebody might murder somebody, for example, and they're not necessarily antisocial. There's a story of a lady who was repeatedly sexualized and traumatized by her husband, and then just one day she snapped and killed him. Right? Is that antisocial? It's trauma, is it not? It's a reaction to trauma, and she was completely dissociated when she did it. When she came to, she saw his body, and she went to town on him. She got him good. I mean, it was a bloody mess, but she was deeply remorseful about it. Oh my God, what have I done? I can't believe this, So that's a sociopathic condition in somebody's window of time in their life that, they wouldn't have done before or after, but these circumstances created it. So when is it justified, right? really interesting question. And then I'll just say one more thing. The lower levels of antisocial in media are really interesting too. It's easy to point out the serial killer and say that's a bad guy, but what about like Jim Carrey from The Cable Guy,
Okay.
right? I had students that used to use him as a case study for borderline personality, which I certainly think, as far as media portrayals go, he kind of fits the bill. He's prone to rejection from Steven, I think his name is, Matthew Broderick's character. He wants to really ingratiate himself, but when Steven doesn't want to be his friend, he lashes out and starts sabotaging the guy's life. That is an antisocial thing to do, right?
Yeah.
But you don't watch that movie and you don't think, oh, antisocial personality. You just think, wow, this dude's kind of nuts.
It's okay. Oh my gosh, it's so long since I've seen that movie, like years and years. Cable Guy, right?
I love that movie. It's really underrated. Have you ever seen What About Bob? Bill Murray.
Yes, Bill Murray is a classic, so I have seen.
So that's another, you can make an argument there that his character is antisocial in that movie because he's breaking all kinds of norms and boundaries. He's stalking his therapist, right? So it's a comedy, but the criteria is all there.
Right. Yeah. Yeah. Well, no, one that jumped to my mind is Fatal Attraction. Is that the one? Is it Kim?
You know, Sharon Stone.
Sharon Stone, that one with Michael Douglas, that is like a classic.
Sure.
Right? Of like a BPD kind of complex and teaching.
He did another episode movie with Demi Moore called that I like even more called oh God, I can't remember the name of the movie, but Michael Douglas and Demi Moore, and she is his boss, and she hits on him, right? In the workplace, she tries to have sex with him, and he refuses. It's very much like what you would see, but the genders are swapped, which is a kind of a nice representation to kind of see that because it does happen that way as well. But like she is assaulting him, and then he goes to tell what happened, but because she's the boss, she's already reframed the story to the whole company that he assaulted her because he's a guy. Everybody believes that's how it went down. So Demi Moore is the antisocial person in that, and an example of how that could show up in a workplace.
Yeah. Now you've got me thinking about lists of movies that I'm going to watch as case studies for my students in psychopathology, right? Treatment diagnostics and psychopathology. So I think I'm going to have you come in and be my guest lecturer in that class when I teach it in the spring. So just FYI, B1.
You got an
invitation coming your way, okay?
I'm there for you. Absolutely. That'd be fun.
So I guess we're kind of coming towards, the end. This has been so fun for me. But based on your experience, what's the most surprising thing that you've learned and that you wish people understood?
Yeah, it's a good question. The most surprising thing that about psychopathy and sociopathy, I mean, is just that people don't know that those aren't actual, like one is over 100 and almost 50-year-old term. It's not right. 1880. So, over 100 years, quite a bit of time. And that they're interchangeably used and that nobody knows what they're talking about. And you see that in society all the time, So I wish people had a little more education about the differences in that because it's one of those things that kind of rubs me as a nerd, a psychology nerd. There's certain terms that people will use. Narcissism is one of them. Oh, he's such a narcissist.
Bugs me.
No, that's not what narcissism means. Just because that person acted cocky in that meeting, that does not automatically make them, and there's a whole thing that makes them a narcissist.
Right.
Right. Or another one will be like, oh my God, I'm so bipolar. I got sad today. That's not bipolar disorder, right? So I want people to stop using clinical terms when they don't know what they're talking about. That would be fantastic.
I do really love that because that strikes a chord with me too. Like people out in the public and also sometimes clinicians using diagnostic terms as labels for people. Like, oh my God, they are so bipolar or
they're so ADD. I'm so ADD, right? I forgot my keys. I don't know where my keys were. I'm so ADD. No, forget their keys, right? Doesn't make for a clinical disorder necessarily. It can, but not always.
Yeah. And also the other side of it is for people who are struggling with those mental health issues. Like I'm a person who's, I would say, pretty high functioning, pretty regulated most of the
You're a
time.
very high functioning psychopath, Leah. I need to compliment you on that. You're doing great. Nobody suspects a thing.
I'm hiding it under the radar. Right?
You're doing a good job. Yeah, totally.
But you know, the whole like ADHD thing, I've been diagnosed and I've struggled all my life with ADHD and have known it about myself and have thought there's something wrong with me, right? Like really internalized that experience regarding, like, I didn't ask for this mental health issue. I was born with it, right? And I've developed it. Now that I understand it more, now that I choose to be medicated, it helps my life and I'm able to kind of function at a high level. But when people say, I'm so ADHD, or everybody's now diagnosed with ADHD, that can minimize my experience,
Sure.
right? And I have a lot of people that I talk to in clinical work that feel very similar, like a bipolar disorder. You know, you don't get to a bipolar disorder overnight, right? It's a series of events and a series of diagnostic criteria that you have to fulfill to be diagnosed with a bipolar disorder or a personality disorder, right? You have to treat somebody as a clinician for a significant amount of time to be able to diagnose a personality disorder.
Yeah, I mean the way I like to conceptualize this is, again, it all exists on a spectrum. And so like if I am forgetful sometimes, that doesn't mean I have ADD. I have a kind of symptom of ADD perhaps. And then you crank that up for far enough on the spectrum and yeah, okay, there's a threshold that I can cross. I can get severe enough that it then becomes, so like that's important to say too. In order for something to be a diagnosable mental illness, it has to be impacting you or your life or your finances or your relationships in some way, right? Forgetting my keys is not that, right?
Yeah.
So it has to be debilitating me in some way for it to really be something diagnosable.
Yeah. And debilitating is serious, right? It's significant that it is multiple effects. But, you know, we've talked about the fact that this is an area that has so much intrigue, it has so much stigmatization, but, you know, but it also is very intriguing for people. So what would you say regarding solid resources like quality books, quality resources, any type of maybe studies that you would recommend for people who really want that research base, that deeper understanding rather than like watching a movie in,
Yeah.
you know, Hollywood depicted movie, which aren't all bad, but still like the research piece.
Yeah, and this is an important question because I just did it today and in preparation for this episode, just Googled, just for the fun of it, psychopath. What's the difference between psychopath versus sociopath? And you have experts competing on what that means, right?
Exactly.
So the first thing you need to know is to just kind of take those two terms and just kind of put them to the side. You're not ready for those yet. Instead, just open up a DSM-5 and read the criteria for antisocial personality, and you will get the gist. And then go to the person, and so that is a personality disorder, but read the whole chapter of personality disorders because you see traits of some of these things in a lot of that. Schizoid personality disorder, for example, is an example of schizoid personalities are very socially withdrawn. They don't crave relationships. They don't want relationships. That's similar to a psychopath, right? They're not exactly the same, but you have to understand the nuances of all this. Good books that I've used over the years for my podcast and my research would include Ronald Holmes, who does really great work around, he built a criteria for stalkers, categorizing different kinds of stalkers. He has a book that I read all the time on serial murder, drawing from credible sources like the FBI database and things like that. Eleanor Greenberg is an expert on personality disorder. She has a book I have on my shelf here called Narcissistic, Borderline, and Schizoid Adaptations. It's very clinical, but it's a good read. She also talks about things like narcissistic parenting. So like a narcissistic parent, how that parent would treat their child and what happens to that child and all the different ways the child can turn out because of that. Spoiler alert, they wind up being narcissists themselves usually. And then as we talked about earlier, The New Evil by Michael Stone and Gary Bricado is very good. It quantifies the reasons people would murder from 1 to 20, 22 or 23, I think it is.
Right. I'm very interested looking at that.
Yeah. I actually have done a whole series on my show about that, covering one level at a time, using case studies and going into the psychology for all of it. So those are great places to start.
Yeah, fantastic. And the podcast, Dr. Michael Drane, is called what?
Yeah, I've got 2 new projects in the works. So one kind of feeds my forensic side. It's called Dr. Psycho, the Dr. Psycho podcast, where we're going to do all our forensic stuff. And then the other podcast is called Trust Me, I'm a Therapist. And it's going to be me and my therapist buddies answering your questions. People can write in their questions and we're answering and you're going to be on that, by the way. I haven't told you yet, but yeah, you're going to be one of my guests. And so, imagine like you and I reading questions that people are asking about more garden variety psychology stuff, relationship issues, and what is depression, and things like that. And then we're just answering questions. So the Dr. Psycho is going to be a monthly release, and then to fill in the rest of the month, you're going to have weekly drops of Trust Me, I'm a Therapist. So those will be coming up in the near future.
So please look out for those, listeners, because you will not be disappointed. You will not be disappointed. So thank you, Dr. Michael Drane, so much, as always, for sharing your experience and your expertise and really helping me and our listeners better understand those complexities and the differences and the spectrum disorder that is antisocial personality disorder. So I think that it's been enlightening and thought-provoking, and I'm just so grateful that I get to learn from you. Thanks for being here.
You're welcome. That gratitude you're feeling right now is kind of counter to the psychopath jams. So you might want to work on that, but I'm just kidding. But you're very welcome. I love you. I adore you. I'm happy to be on, and hello to your audience. And happy to be here. It's been fun.
Wonderful. Well, thank you to all of our listeners for tuning in to this episode of Tea with the Experts and Dr. Leah Merle. I really hope today's discussion has given you a better understanding, especially beyond the myths and misconceptions. So please remember to subscribe to my podcast for more in-depth conversations about mental health, human behavior, and everything in between. And join me next time as we continue exploring the fascinating and complex world of the human mind. So until then, take care of yourselves and each other. This is Dr. Leah Merle signing off. Please subscribe. Bye for now.